This guide outlines the Automated Lesion Assessment, or ALA, workflows for pre-PCI and post-stent procedures utilizing IVUS 1, 2, 3. Pre-PCI workflow. Begin the pre-stent workflow by advancing the IVUS transducer 5 to 10 mm distal to the lesion or area of interest. Label the IVUS run appropriately. Select your desired pullback speed and initiate recording. Upon completion, activate ALA in AVVIGO Plus. IVUS 1. Determine length. To identify the lesion length, toggle the borders off and adjust the distal and proximal keyframe markers. Set the brackets to mark the healthy landing zone. They should remain fixed after this step. IVUS 2. Study morphology. Locate the minimum lumen area by selecting Min, and then move the scrubber between the brackets to determine the right modification strategy. IVUS 3. Analyze diameter. Toggle the borders on and select the dual view to analyze diameters at proximal and distal references. Post-stent workflow. Select pullback speed and initiate recording. IVUS 1. Stent edge. Position the ALA brackets at the distal and proximal stent edges and apply ALA. These brackets now delineate the stent boundaries and should not be repositioned. Toggle borders on/off to hide borders. Select the distal bracket. Initiate dynamic review to evaluate for edge dissection. Assess plaque burden and determine if there is any geographical miss. Repeat this process at the proximal stent edge. IVUS 2. Stent apposition. Move the scrubber between the two brackets to observe any malapposition in the cross-section. IVUS 3. Stent expansion. One way to check stent expansion is to identify a distal lumen reference frame that has minimal plaque burden and is within 2 to 3 mm from stent edge. Then click Bookmark. Click Mark Reference and confirm there is a blue REF symbol on bookmark thumbnail. To calculate relative stent expansion, return to the Min frame. Note the numerical stenosis percentage, the inverse of which represents the stent expansion percentage, in this case, 93% expansion. Utilizing IVUS 1, 2, 3 in the ALA workflow helps clarify decisions, increase efficiency, and remove the guesswork. Supported by mounting clinical evidence, using IVUS throughout the PCI process helps optimize procedures and improve patient outcomes.